streaming audience in, but I've been looking forward to this for discussion that we're going to have today for quite some, well, not really that long, because it hasn't been that long that I discovered this innovative healthy home laboratory that the University of Pittsburgh has created. And when I found it, I was immediately emailed them and said, man, I would love to introduce what you're doing to our community. And I was absolutely delighted that they accommodated me, especially on August 25th, which happens to be like, I think either the first day of school or orientation or something is going on there. But let me welcome the team from the Healthy Home Lab. We've got John and Pam, who are actually in the lab right now. And then we've got Portia, who's at a remote location. But before we dive in and we learn the who, what, where, why, how this project came about, let's get to know y'all a little bit better. I'll start with you, Portia. Tell us a little bit about you and your role with the Healthy Home Lab.
Hi, Steve, and hi. Thank you to everyone who's joining the webinar today. My name is Portia Singh. I am the tech transfer lead for the Healthy Home Lab at the University of Pittsburgh, where I am also an adjunct professor. I am based remotely, but have a long history in Pittsburgh. I got my PhD at Carnegie Mellon University, right down the street, where I studied technology for aging in place.
Oh, wow.
After that, went to the Social Security Administration, and then spent almost 9 years at Philips Research North America, so the North American Research Lab for Philips Healthcare, where I then left and joined Philips Lifeline, so personal emergency response service, very well known, but I was a senior product manager at Lifeline. I've also been in the caregiver support space, most recently at a director of research role at CareLoop, which is a startup that is providing caregiver support as a employee benefit. And so I like to say that my career has spanned the aging journey in different facets, even with my role at the Social Security Administration in retirement and disability policy. So have been with the Healthy Home Lab, I guess about almost 6 months now, and really trying to take what the researchers are doing in the lab and find partnerships with external entities, government entities, and also see how we can get those technologies transferred into the hands of all of the individuals who we are really building this for.
Man, what a background. And it's I love it when number one, you were saying that as part of your academic program, were working on aging in place solutions. But that's one of the things that I'm thrilled about to talk to you all is that this academic institution is going out and really trying to make a world a better place for all of us as we navigate the chapters of our life. Okay, this is awesome, Portia. The John and Pam, if you want to share a little bit about your background, and then let's learn about this Healthy Home Lab.
Great, thanks, Steve. Really appreciate the opportunity to present and talk about the Healthy Home Lab. So my name is John Perlman. I am the technical director of the Healthy Home Lab as part of my role at the University of Pittsburgh. I also serve as the chair of the Department of Rehab Science and Technology. And that department has for over 25 years focused on the technologies that are available to support people with disabilities, people who are aging. And so we have a team of engineers, a team of clinicians that train students, that provide services in an outpatient clinic here in Pittsburgh, and do a tremendous amount of research in that field. And so we're excited to be part of the Healthy Home Lab. Most of The Healthy Home Lab is staffed by folks from my department, several engineers and clinicians. And my background is as a mechanical engineer, and for my career has been focused on mobility devices, designing them, developing standards to make sure that they are of high quality, and testing those products. And I've done that work in the U.S., both within the VA system and outside the VA, and then have spent a lot of time working on developing and promoting those same types of standards internationally, and work with the World Health Organization on several different activities. And so, my role here is to help guide the technical activities. You can see we have folks like Portia, who we brought in, who have tremendous amount of industry expertise, and make sure that the work we're doing here can be really relevant and be impactful, and not as sort of stuck in what can occur in academia is really, academically driven activities that are just to write papers. And so we are very much focused on the implementation and what can have an impact right away. And so, yeah, again, really excited to be part of the webinar, excited to talk with you about the Healthy Home Lab.
Love it. All right, Pam.
Thanks, Steve. Thanks for inviting us. So I'm going to give a different slant to our team. I'm Pam Toto, and I'm an occupational therapist. I'm also a professor here at the University of Pittsburgh and the director of our clinical services within the Healthy Home Lab. Occupational therapists work with people across the lifespan to help them be as independent as possible and do the things that they want and need to do to live a full life. My expertise is working with older adults and helping older adults to be able to specifically age in place and to live your best life. I practiced as a clinician for over 20 years and transitioned to a career in academia and research because I was frustrated with the system. We have a lot of good ideas that live in journals, and it seems to not reach people. And so, so what I bring to this team is I think the pragmatic element. My research interests are really focused on knowledge translation and implementation. How do we take these good ideas and make sure that we are considering what older adults want and need when we're designing, and also when we're delivering programs that matter. So this house is a dream for me, because it really gives us a chance to speak the same language, for people to be able to visually see what we're trying to achieve, and also really advances us to offering solutions to make this world a better place to grow old.
I love it. This, man, you got like the safe and accessible home dream team here. This is absolutely amazing. All right, so I know the burning question is, at least in my mind, because I intentionally did not chat with you all in great detail about the home, but tell us how it came about, why, the who, what, why, when, where, about how this amazing project came about.
Yeah, I can kick that off, Steve. I actually have a short slideshow I can show you that kind of maps it out. And we do have the dream team. I would say some of the key folks are here, but in truth, we have a lot larger team that I can talk about in the slide deck. So this is really just a brief overview of our activities and what we've been up to, and gives you some of that who, what, where, why, and how. So we think of our activities as in three different areas. One is in the assessment. So one of the most important things is that we can measure what the needs are of the individual we want to help and support and empower, as well as what the barriers are within the house to do that. So there's many different activities focused on the assessment pieces. My area of focus, like I mentioned, is related to the technologies. So those are both physical technologies, stair climbing support, for instance, and then digital technologies like smart home technologies that we're developing, but also evaluating. So existing technologies that are available out in the market that are potentially could benefit folks to age in place, but are not yet used that way. And then, putting together the assessment and the technologies, we think about the services and understanding how those services are paid. Who are the folks involved in actually delivering them? Where are they being delivered? How do we have to build collaborations through different providers and payers to actually provide those services? So those are the kind of high level way that we organize the activities. We have the facility itself, and I'm happy to do a walkthrough later, but we have we're in this, over 100-year-old house that's right near campus in Pittsburgh. It is a traditional, actually, 4 full stories if you include the basement, and steep stairs and a bathroom in the basement and no bathroom on the main floor. It's a very traditional house in Pittsburgh that the university's purchased for us. And we have in the basement, we have a shop that allows us to do prototyping on site. And I'll show a picture of all the team members. We have folks that know how to do home modifications. We have a group of engineers and clinicians, all that are working here. So we want to make sure they have the tools available. We have on the main floor a fully decorated house that includes the kitchen, the dining room, and the living room that very much feels like a home. We had a group of occupational therapists do a project in here called the House to Home project. So it's completely decorated and has a dining table, couches, recliners, and everything you typically see in a home is here. Fully operational kitchen. And then upstairs where Pam and I are, we have the back of the house includes a fully outfitted bedroom and bathroom. And so we can do studies back there. We can install technology, evaluate that technology. And then the room that we're sitting in is the conference room right in the middle of the house. And then on the front of the house on the second floor is desk area. So we have a large team that's here daily to run the different projects. And so we have seating. So it really operates both as an office space for our team, as a lab space, and then also a community gathering space where we bring our partners in here to provide guidance on the types of activities that we're involved in. Our team is large. So we have a group of clinicians, engineers, policy experts, both internal sort of traditional faculty and staff that have their main role inside the university, as well as folks like Portia who serve in a dual role outside the university that are adjuncts, but still supporting the activities to translate those out into the community. So we do really, I think, have the dream team that can help bring these ideas, these services, these assessments to reality and to practice. We have really been at this only since 2021. The University of Pittsburgh is, large, and it's a leading institution in terms of NIH funding and funding from many other, government and foundation sources. And there has been aging in place type of work going on for many years. What we developed the lab as really a home to that, to try to bring the experts from different parts of the university together to build that team that can actually, has been able to be successful at getting additional funding to support more collaborative work. And so we've tried to pull the strings from different groups around the university. That includes many different schools: engineering, School of Medicine, our School of Health and Rehab Sciences, Public Health, have all really come together and supported the evolution. We've done a lot of hiring and bringing in everyone from individuals with disabilities that are serial entrepreneurs to product designers to clinical teams that have expertise in this. We had access to the house. We were doing this even, long before we had access to the house, but we've only been in the house for about a year. We got access in September, so it'll be a year next month, and then started to build out the house and the laboratory, and we're successful in receiving grants from HUD, from the state, from the VA, and one that's just about to be awarded from the NIH. And so we've really, this idea that we hatched about trying to bring the team from the university as well as experts from the field has really materialized into a real dedicated focus of the university to develop these types of solutions in close collaboration with the Housing Authority in Pittsburgh, with the AAA in the Pittsburgh region, with Women for a Healthy Environment. So we are really not only, a very strong, have a very strong university team, but working in close collaboration with the community partners. So moving right along, a lot of this, everybody I think on this webinar knows this. We have a large and growing aging population that is accelerating. There is a strong desire from the individuals to live at home, from the government who's supporting folks to keep people in their home because it tends to be a more efficient way to provide services. But we are also faced with the environmental challenges of the housing in the United States. And worst of all is the Northeast. And I think worst of, I would say not maybe worst, but some of the most challenging housing is here in Pittsburgh in the Rust Belt, where there just hasn't been a lot of population growth and the economy has not grown in such a way to do a lot of renovation. So we have a lot of housing needs and environmental challenges to help support the folks. So this is, why we have, done this in Pittsburgh. It is the petri dish of really trying to develop these solutions for an aging population we have in the region and an aging housing population that needs solutions quickly. And that sort of the next slide is just showing the age of our housing in the Pittsburgh region. These are the three rivers coming together right downtown Pittsburgh. And what you see in green are the houses that were built before 1930 that have the steep stairs, that often have steps into the house, that rarely have a bathroom, certainly not a full bath or bedroom on the main floor, that are significant barriers for people to live as they age in their homes. We have several areas of focus that I can sort of pop through as I walk around the house later if I get a chance. So we think about access, mobility, safety, fitness, and smart home. Those are ways we categorize the technology that we're working on. Some examples of our work: we have been working on various forms of assessment apps. So this is an example of one of them. The current gold standard is still paper and pencil and clipboard. We've tried to evolve that as a way to streamline the assessment process, really add technology into it. And so that's an area of focus. We also have an example of some of the mobility technology that we've developed, led by Dave Brienza. This is a continuous rail system that we're developing to provide mobility solutions that are adaptable over time throughout the house, that are also aesthetically pleasing. So this is not just your typical hospital type of grab bar or support getting out of bed or going up the stairs. And intent is to be more elegant. And so we've evolved that product pretty quickly and are waiting for NIH funding and have a commercial partner already ready. So this is one of the more sort of accelerated technologies that we've been able to push through the house. We also have stair climbing work that we're focused on. We start in the lab, like in our other laboratory environments, and then develop solutions that go in the home where they can be evaluated by stakeholders. This is more stair climbing type of work that we've developed. All of our work goes through, a pretty rigorous evaluation cycle and patenting to make sure that it can be commercially viable if it proves out to be effective and financially feasible. Ramp designs that we're looking at, again, a perspective we have is that these designs have to be integrated in the home like they feel like they were part of the home. And so, an aluminum ramp that is something that is an eyesore, can be an eyesore for the homeowner as well as in the neighborhood. And so we're trying to develop more elegant solutions for these challenges. We have a smart home technology center of excellence that is housed here at the Healthy Home Lab, looking at smart speakers, how they can be useful to older adults and people with disabilities in their home, the training that has to be developed around supporting individuals to use them, as well as the clinicians that are actually providing them and the technicians that are providing them in the home. And so this is an example of some of our team doing demos of that and gathering feedback within the home. So the house is fully outfitted with this type of technology. And so that's kind of a brief overview of the work that we're doing. Really excited. This has grown very quickly across the different teams that are here running experiments. We have students throughout here every day. We're also teaching courses here to make sure the clinical students that we're training understand how to deliver services in the home and understand really the challenges that people face in the home. So we're trying to, move people out of classroom environments and use the Healthy Home Lab to make sure that people understand the context of where the care has to be provided.
Man, this is absolutely amazing. I mean, there's so much there to unpack, and I all I can think is you were talking about the housing stock in Pittsburgh and how unique it is. Like, I mean, in the Washington D.C. area, we have homes, but they don't look exactly like that. They're similar, but the value of having something like this in your community where you can sort of see how modifications and things could be done to homes that are somewhat similar to yours. Every community in the United States should have something like this. Have you talked to any other universities or communities about replicating what you've done in their regions?
Need to start with this?
Yeah, please.
So Steve, there's great work being done throughout the country and using homes. Oftentimes the whole home is outfitted kind of with the end product and all the things it could be. So they look very futuristic. I'd like to think they look like the Jetsons when we were growing up. Now we're living in the Jetsons world. So, and the Healthy Home Lab is a little bit different because we really, and I think that I'm probably the leader of this. I want us to maintain the elements, the traditional elements of the home. So what we're trying to do is not recreate the whole home. We're trying to better understand how the person interacts and fits with their environment. So even though we're using this home and we're building this different technology, I think the really neat thing is our students and our partners and our research, it's designed to be transferable. So there's kind of two messages, like what works, but also how do we as people who can make a difference better understand not just the physical abilities, but the social and emotional pieces that are attached to home and why people choose to continue to do things that might be hard or why they still want to stay in a home when they can only live in one room of the home. And so to answer your question, we haven't at this point in time, as John mentioned, we've only been in our home for, I mean, the lab's been around, but the house has been about a year. And we haven't reached a point where we're saying, hey, can you rebuild this somewhere else? I think we've been more focused on people understanding the concept of again, not just the environment and the person, but the person environment interaction and how we can all be more effective at that. And I would just say, you were describing Washington, D.C. homes. I've been in Baltimore row homes.
Yeah, they look just like that. Yep.
It looks so we are in Pittsburgh, but I think, the work that we're doing here really does have transference to homes across the United States. I mean, maybe I live in Florida and I don't have a basement, but I have other things happening. So we're really trying to be mindful of keeping this house a home, number one, not getting rid of the original things, but we really want to show the problems for like student learning and also for brainstorming, and then also putting some of our solutions in so people can see how they fit without having to redo the whole home. And then last but not least, how if you live somewhere else in the Midwest or in the central part of the United States or in the South, how can you take the same ideas and concepts and transfer them over to make sense where you live and practice and research?
And if I may add to what Pam is saying, in the tech transfer world, it's really important for innovators to be able to see the actual environment as the environment is likely going to be presented to them, because so often we may stay in the lab and it becomes a pretty, the best the best case scenario, and life just isn't like that. And it's relatively common when folks go out into the real world, that there's some stumbles with respect to getting the technology just right, and also just with the broad range, home modifications, for example. You can do very low cost modifications that can help someone, or you could just redo the whole house. And just understanding that people live on a spectrum. People need to still be able to be safe in their home, regardless of if they only have a few dollars here, or if it's on government funding, or even if they can just pay for remodel of the whole house. And I think this approach that the Healthy Home Lab takes gives us a better position to be able to transition our model in different places and be able to see how it fits. So
I love it. Well, let's see. Peru is asking, she says, thanks for highlighting significant barrier to aging care. She'd like to know a little bit, and I would too, a little bit more about the assessment app project. Tell us a little bit about that. That sounds awesome.
Sure. Yeah, I can. I can fill in one of the areas that we focus really heavily is through a HUD grant that we received, is developing and expanding on current assessment tools, and that assessment is really to build on the current assessment that's done in an environmental assessment. So when an OT goes into a home, they do a functional assessment, they do an environmental assessment. And what we learned from our clinical team is that if there's an issue with mold or air quality that they notice, they have to stop services, because there's really those aren't considered as part of the strategies that can be mitigated through current services. So an area of focus related to the assessment is for us to develop an assessment tool to evaluate air quality issues, whether the presence of mold that has a health risk, and then integrate those assessment tools into your standard environmental assessment. And so that's an example of a project that's ongoing that includes a team that is in public health that's an expert on air quality, that's in engineering that are experts on mold. We're using the house as an environment where we're actually taking different rooms of the house and adjusting their level of humidity and whether the air conditioning is on, and we're trying to develop really basic assessment approaches to evaluating whether there might be a high risk of mold being mold in the house, or developing a strategy for evaluating whether there's air quality issues and how to mitigate those. So that's one of the areas that we've spent, really the last year focusing deeply on, with the intent of trying to take the current assessment tools that are being used across the country and adding an environmental assessment that takes into account these types of health risks. So then we can mitigate those just, along with the strategies that are, related to fall risk. And in the bathroom, we also want to add on to those types of assessments, the issues related to other environmental hazards like mold and air quality.
That's great. And I know that triggered a bunch of other questions, but the when you talked about it first, you were talking about, the assessment as opposed to using the clipboard. And I'm assuming, Pam, that this is one area where you're pretty involved in terms of, because in general, it's been my thought that the occupational therapists are the ones doing most of these assessments of the home and providing recommendations on what the homeowner should do. Am I correct in that?
Well, yes and no, Steve. You bring up a really good point. So we talk about opportunity and also access sometimes. So you're correct in that in the United States currently, occupational therapists have really taken a lead role, as well they should, because they understand that person-environment connection. But there are a lot of people who don't get to the occupational therapist first. So I can talk about two pieces. The work that John just described is kind of the precursor. So occupational therapists yes, once they receive the referral, they have the opportunity to go in and to help mitigate some of these problems, but not everyone gets referred to an occupational therapist. Or how do we identify these problems before they become so large that they're really insurmountable? And that's what we really kind of was the impetus behind the project. So we've really been working with our people who touch the community more regularly. So our partners, our interested partners, like members from the Area Agency on Aging or nonprofit organizations who are going out and helping, even like our local housing and urban development. They're seeing a lot of people in their homes. So not only are we testing these products and we're designing them, but we're listening to those folks, and they're our partners and collaborators, and we're saying, okay, we know your workload is busy. We know that you can't do too much more, but how many more questions could you add? What's feasible? So we're designing with a knowledge translation implementation mind, with the idea that when we're done with this, we want to be sure that we're not building something they can't do. So that's the first step of kind of behind what John was talking about. We're not testing that piece yet with occupational therapists. We're teaching that with the community health workers who are going out, and then they know who to call. They know what to do. We can identify the problem while it's a $2,000 problem instead of $25,000 problem.
Oh,
So that's, but on the flip side of that, and to answer some of the people's questions, there are some really elegant occupational therapy assessment tools, including ones that are digital. And rather than creating a new one, we are partnering with some people who have already been in that field to kind of, again, because our end goal is to improve quality of life and improve aging in place, not just to design tools. So our clinical service team already partners with one electronic tool that's really gained a lot of success and has recently won an award, was talked about in the New York Times. It's called Home for Life Design. It's an electronic assessment tool. So we're collaborating with Carolyn Sittom, the owner of that company, to take what we're learning and move it to the next step. So we actually are also always collaborating with other people. We don't have to reinvent the wheel. We'd rather make a better wheel with someone who already got started. So that's been another fun part of the Healthy Home Lab. People want to partner with us to advance the work together.
Excellent. Okay. Well, I'm looking at the clock, and we've got 20 minutes till the top of the hour. We've got some questions that are coming in, but but I'm hoping that maybe, John, we were trying to do a little bit of a tour. You want to try to load up your iPhone there, and we might be able to take a walk around the home. One thing that intrigued me personally that I thought was a brilliant idea is that mid-wall molding that can turn into this sort of modular support device. That I thought that was a brilliant idea. Are you getting some positive response to that?
We are, yeah. I'll happily walk you around. I wanted to just one thing to add on to what Pam just said about Home for Life is just a comment that we see that kind of interaction with companies like Home for Life and Carolyn, and supporting the development that as part of the core goal of the Healthy Home Lab, and the way that we these direct connections with Home for Life is one example. We are also an age tech collaborative test bed as part of AARP's effort. And so there's another area where we've established ourselves in part of that community that AARP is supporting, and connected with other small, startup companies and trying to support their success also. So let me just boot up my phone to make sure that I can share my screen, and then I'd be happy to walk everyone around.
Yeah, and while you're doing that, let me read a few other questions that have been coming in. John says, I've been renovating my home to be handicap friendly, almost ADA on the main floor, 3-generational rental home, almost a full-time job to design, then work closely with contractors who've done very little ADA work. I'm learning so much by actually doing this project. All right. Yeah. Thanks for that comment, John. And then Let's see. Karen, Assistive Tech Specialist, ATP, and Aging in Place Specialist can also do these evaluations. And Karen, send me an email. I've never heard that term, Assistive Tech Specialist, and that might be a great discussion for us to have with introducing that profession to our community as well. Let's see. Oh, Courtney asks, is the assessment tool available to others in the aging profession to utilize? The assessment tool is not available yet. You're developing it, correct? But
the assessment tool that we're working on through our grant with the Housing and Urban Development Authority, that's not ready yet because we haven't finalized. What we're trying to do is kind of find the just right. One of the pieces of feedback from our collaborators, our community collaborators, has said, we'll do this, but we don't want to assess if there's no solution. Like, we're already busy. So that was a great learning piece for one example. So you could expect probably, we hope that within the next year, that element will, by the end of next year, that project will be done and we'll have some feedback. Conversely, Home for Life Design is a professional tool that we use right now, and that's available to anybody. So one, not yet, and the other one, yes.
Okay, excellent. And then I think you answered this earlier, but I'm just going to restate it. Robin asks, will there be funding to bring this prototype and modifications to elderly homeowners across the country that would like to redesign their homes to be a healthy home lab? Robin, I think Pam said earlier that this is more of a laboratory for design collaboration and as opposed to an actual individual's home. Did I state that correctly?
Yeah, I think, Steve, yes, you did. But I think just to build on something that John said earlier, one of our outcomes is we don't want to just make Pittsburgh a better place to grow old. We want to make the world a better place to grow old. So, John had really highlighted that we work with small business, so we are ready and poised, and we're already having success with people who create ideas in our lab to getting it to the transfer port where it is a commercial product. And we're also working with people who had a really good idea and started, and they needed more momentum and they needed more partners, like through the AARP Age Tech. So our ultimate goal is that everything that we identify here does become available to people across the country. And I'll just say one more thing, I see John's jumped on, is we've already had a lot of experts in this area, including some folks that have already been on your podcast, Steve, I believe, who've actually come to visit, and they're like, hey, how can I collaborate? I'm in Florida. Hey, I'm in Texas. As soon as you're ready to go, I'm ready to bring those products here. So we're creating a collaborative army that's national. So as these products become available, we have people that are already part of the team here. They're not on that picture, but they're part of the team and they're ready to go. They're just waiting for us to say, here's the green light, let's go. So the answer is yes. These things will be, we won't have achieved the goal that we want if they aren't available to everyone across the country, and they're designed in a way that makes sense for where people live. They don't have to duplicate a Pittsburgh house.
Man, I love it. All right, we've got John ready to go. This is going to be a great innovative experiment here to see if we can pull this off. Let's see if we can see you, John. Can you hear us, and can we hear you?
Yeah, I think I'm ready to go. So I just wanted, can you hear me okay, Steve?
Yeah.
All right. So I'm just going to walk through the house kind of quickly to give you a sense of what we have outfitted, how we've outfitted it. So I'm in the back. I'm still on the second floor. This is the outfitted bedroom. So you can see we actually have it's a smart bed that actually can move based on commands to the Google Home, which you can see over there on the heater. We have a smart air conditioning. You can see that we have even, an air purifier here. This is part of our HUD project, and different assistive devices, including, risers for for just really low tech systems to do a riser for this love seat, for instance, as well as more high tech systems that we're testing, fall detection systems that are on on the wall here. And so this is an example of how we've kind of created an environment that feels very much like a home, but also has the high-tech and low-tech integrations that we can evaluate. So an example of some of the evaluation is the system you can see on the side of the bed to help somebody get out of bed, which is a very low-tech, commercially available system, versus something that we're developing as part of our continuous rail system that's right here. And so it allows us to bring stakeholders in, to evaluate, clinicians in, to guide us on the technical design. So that's an example of the bedroom. The bedroom's also sort of wired to the rest of the house. So we have systems to trigger lights to turn on if you stand up and get out of the bed and come into, for instance, the bathroom here. And also outfitted with fall detection, outfitted with smart speakers to help simulate the use of and develop actual service models to use these types of technologies in the home. So that's how we're using the house. We have, of course, fully outfitted tub here with different assistive devices. Though we can look at those, we can identify potential gaps, potentially design additional products to support and address those gaps. Going down the stairs, so is some of the stair climbing technology that I showed on the slideshow. You could imagine that you need something for this staircase. I don't know if it'd be difficult to see through the phone, but it's incredibly steep, incredibly narrow. It also, the treads and the risers are not necessarily continuous because over time, these have sloped a little bit. And so it's a little difficult for anybody to get up and down these stairs. And it's an example of some beautiful woodwork and all the craftsmanship in these older homes that people want to stay generationally in their homes, but can't often. And that was really the story of this house and why the university was able to buy it, is the family that lived here ultimately couldn't stay here because it wasn't accessible to them. This is the living room downstairs. And so we have a series of air quality systems that are simultaneously measuring the air quality in here, and that can be compared to the gold standard that's on the wall. And this is to help, identify which are the most accurate if we intend to suggest those as part of the HUD study to mitigate indoor air quality issues. This is the dining room. You can see one of our partners has developed highly accessible furniture. So this is also kind of a showroom for advanced technologies. This is accessible for a wheelchair user. It's hard to see, but underneath the table, it actually has a handle to help people stand up. Similar console table. This is operating as a lab. So what you see on top of the table is a series of different smart home technologies, plugs, and cameras that are all being benchmarked against each other so we can determine which perform better. And so as I walk into the kitchen, similarly, we have a smart. Yep.
Back up one step and show the hutch on the right, please.
Oh, the hutch.
So this is a hutch. It's very meaningful. It's beautiful. One of the things we did was if you look at the handles on the lower drawers, something as simple as a drawer that maybe you need two hands to be able to open, something simple like changing to a single handle. We put that handle in the middle to be able to help identify that someone who only maybe has one hand use can still open that drawer. So just showing that doing simple solutions as well without changing the elegance of the house can still allow people to be able to use their home and things they need. Okay, thanks.
So yeah, and thanks, Pam. That's just really trying to point out that we're looking at all levels of technology. And so this is in the kitchen. Again, lots of technology through the home. We have a lot of smart home or smart locks that are installed almost in every door so we can determine how they perform. We're looking at medication management, a variety of different smart speaker and smart systems that we're comparing against each other. And so I won't take you to the basement. I'll just point down. The shop is down in the basement, but this is where some of our additional stair climbing technology is installed so we can evaluate it. And heading upstairs, I think I missed showing off the continuous rail system, which we have installed. Of course, this is an example of a traditional kind of commodity rail system. And at the top is where we've installed the what we call the Mobius. And I showed that on the slideshow. This is the rail system that we have funding from the VA, from the state, from NIH to support, which is essentially a chair rail system that has actually built over an aluminum extruded system. So it's incredibly strong. It's very versatile, as well as looks very nice. It allows somebody to put various attachments. This is obviously a grab bar, but it can be taken off and then it looks as if it's just another piece of chair rail. So this is an example of the type of product, simple, there's a gap in the market, and it's much more elegant than what's currently available on the market.
That's really cool.
And John, if I could just mention, so as we mentioned before with the Healthy Home Lab, we're really looking to collaborate with entities that can help us get technology and innovation out into the market. And so one of our big projects right now is a collaboration the Healthy Home Lab has with the UPMC health plan. And so we are just about to launch a pilot looking at a new way of delivering occupational therapy evaluations, as well as home modifications paired with smart home technology into the homes of older adults, particularly dual eligible Medicare, Medicaid population. And so we've been working very closely with the health plan over the last several months, and we're really about to launch this pilot. And, you know, when successful, this really shows a collaboration and how we at the Healthy Home Lab really are looking at things from the perspective of the older adult, the family, the technologists who are trying to create new technology to get into individuals, but also the payers, the healthcare providers. Pam has been really instrumental in getting us and corralling us around, you know, how we can, you know, look at the profession of occupational therapy and add to, you know, their abilities by just adding technology in places that traditionally have not been thought of. And so we're very proud of that collaboration. It's a very strong collaboration, and, you know, we're looking at launching this pilot right in the midst of Pittsburgh winter. So, you know, cross your fingers for us. This should be fun. So,
well, you know, I'm so glad that we did this tour, because it really gave me a better picture of how amazing this project is. Because, you know, I've seen a lot of universal design demo projects that are very impressive because they have every possible amazing improvement, and you can tell, you know, it's architecturally, everything looks great, you know, whereas this is clearly a real home that looks like all of our homes, with the old school tub and the you know, and the kitchen and everything like that. And what struck me, I was reminded by this doctor I heard talk once that said, you know, I used to work at the #1 sleep center in the United States, and I'm this sleep study expert. And he goes, how ridiculous is it that we're making people that have sleep problems come into a laboratory that's not their home and monitor their sleep there? It's sort of like, now we've got the technology where we can do the monitoring in their home, and that's where we need to be doing it. And like, I think what triggered that remembered that was talking about air quality. I mean, that's something that's a blind spot for all of us. And but that could be leading to our mom and dad's health problems, is the air quality that they've in their home that they've been living in for the last 40 years.
Yeah, we know. Well, now there's no home in Pittsburgh that's been more assessed than this one in terms of air quality. We know exactly which mold spores are in here, you know, what air quality issues are, and because we can do that here, and we can bring our community partners in here, It helps ground us as the researchers into what's really feasible and important in the work. And it also helps us connect with those stakeholders, which are ultimately the folks that are going to be doing it out in the community and are currently doing it. So anything that we come up with them up is, what they're going to adopt. So it's been a really important and valuable part of this project is to have a physical space in the community to do it.
Great. I guess for those of you who participated in the tour, you might wonder why the bathroom looks like such a mishmash. And that's, I've been kind of a bear on that one. The University of Pittsburgh, we have brilliant students. Every year we have students who are smarter than the students the year before, which pains me to say because I'm a graduate of the University of Pittsburgh. Today's students are smarter. But if we don't show them the problems, first of all, if we don't show them the problems, then how are they going to develop solutions? If we make that bathroom look newfangled and fantastic and accessible to the final degree, then they have nothing to brainstorm on. That's number one. But number two is when we think about homes, we share our homes often with other people. And so I work with clients who decline a raised toilet seat because other people use the toilet and they don't want someone else to sit on that raised toilet seat, or someone who doesn't want a flexible shower hose because the water pressure declines and their granddaughter has long hair and needs to wash her hair and get the shampoo out. So, understanding those very human elements. So we really did a dance on trying to change things, but not change the essence of what home means and all the factors that are part of that. So if you were looking at that bathroom and wondering, dang, they have too many items, and why are they doing that? We want to keep it that way so that our students and our future scientists, our future inventors can see the possibilities.
Yeah, no, that when I saw the bathroom, then all the buttons clicked for me, because we know you could rip out that shower and create all accessible. We know that can be done, but then it's not a laboratory anymore. It's not something that, well, it's still a laboratory, but it's something that the students and you all can work on what all of us are currently dealing with in our homes.
Right.
But that's wonderful.
I'll say, if any of you who are on the call ever find yourself in Pittsburgh, reach out to myself, Pam, John, Steve can get the contact information. We not only do tours for partners or our professionals. If you are a older adult who is aging in place and really want to see how there are folks who are really trying to make that easier in practice, you can tour it too. So I will say that I am remote, and my first time in the house was just an immediate flood of thinking and ideas. And so it's one thing to talk about it and see other people in it, to actually be in it yourself. It really is an experience where you walk into the door and you're starting to see and feel and hear, and just the thoughts, just your light bulbs start going off. So having this particular lab in the way that the team has maintained it, has thought the vision through, is really an asset that we have at the University of Pittsburgh and in our department, where I really do think that essence of that feeling that you get when you walk in will really spark a lot of collaboration and a lot of great innovation that'll come out of it.
Yeah, and Louis Tenenbaum is on the call, said that he visited the home and was really impressed with it. I know we're getting close to the top of the hour. And so folks, remember, this is recorded and you can access the recording at proaging.com. But there was one question that I was hoping you guys might address, because this comes up a lot on our discussions related to the smart speaker and the smart home technology. And the question was related to sort of the privacy of smart speakers, which that always comes up whenever we bring that up. But I'm interested in just sort of some of the research and the areas that you all are working on with smart speakers and smart home technology. Any insights that you're gaining or projects that you're involved in around that space?
Let me start by saying something that's really important. I think one of a couple of neat things about the projects that we're doing in the services, like for instance, the project Portia was talking about, everything that we're doing here is still person-centered and person-driven. It's really the older adult is the director of wherever we go forward. And so we really use, just in technology in general, we really consider readiness for change in terms of not only what people's goals are, but how ready they are to embrace some of the technology. John mentioned we have a lot of low tech here, and we have some of the coolest smart tech you'll see. But if someone's not ready for it, we're not gonna match. Secondly, we're not in the business of certainly there's different types of technology that can allow people to monitor remotely, but any of that kind of stuff, any technology that's going to be in is really driven by the consumer and the client and what they want and need. And so, I think that we've been really targeting towards the older adult is very person-centered, and also their strengths, not their limitations. This is not a punitive, this is about empowering and partnering to help people age in place. So I'll let my colleagues finish on that, some of the concerns with that, but we really make sure that our occupational therapists and any of our clinical people are really emphasizing that there's nothing to spy on you, there's no Big Brother's not monitoring, and if they don't want it, then we're not gonna pursue. Do you?
And
I'll say one thing. I think Portia is really the expert on the context of using these as, in the home through kind of a business lens. I think we all are concerned about the security of smart speakers and smart home technologies in our phones, right? This is the security associated with how data is gathered anymore is a concern to all of us. And when it comes to cameras and other health, really protected health information, the answer is yes. And using Pam's, really lens of making sure it's patient-centered, we're trying to address those concerns. Portia has a lot of experience in the industry of understanding how to address those concerns. So I'll go ahead.
Yeah. So as long as technology has been added into the aging in place realm, there's always been a concern about privacy and security. Thankfully, the manufacturers have become and just the community of consumers have really pushed manufacturers to provide this more private and secure way of utilizing their technologies. One thing that I don't think we touched on maybe as strongly is one of the aspects that we do in the lab is training, and we actually develop training. We are training older adults, we're training professionals, we're training students. But for example, in our pilot with the health plan, our OTs will be training the individuals who receive a smart speaker, not just on how to use it to do their routines and to work on their home, but also on safe privacy practices when utilizing these devices. And so that is a concern, but I do feel that the technology has come a long way, and there's been a recognition that privacy and security is very much important and would be a barrier for consumers of any age demographic to actually use that technology. And so a lot of privacy and security features have been put in place that we are also teaching the older adults and training them on how to utilize these devices in a safe and secure way.
I love it. This is a really great comment from Elva. I had never considered one of the downsides of having a bathtub with the little door that provides step-in accessibility. You have to sit in the tub while the water drains out at the end of the bath. Elva, actually, you have to sit in the tub while the water goes into the bath and out of the bath if you want to use that little door. So that really speaks to ripping the whole bathtub out and having just a no threshold shower type thing with some seats or something like that. But again, it's all customized to the person's budget and what they need and what have you.
Even if they love baths, if they love baths, it might be worth it.
No, you're right. Yeah. Okay. I think we can wrap things up here. And let's see, Ravi says the evolution of matter-based sensors and local API will enable critical fail-safe capabilities to be pushed down so the local computer, well, everybody can read this.
Thank you, Ravi, for adding that note. That's exactly.
Can you do that in?
We should collaborate because
Steve speak what Ravi is talking about.
He's giving the technical answer to what I was just saying, where industry and consumers and innovators have basically pushed the market to be more considerate of security and privacy. And Matter is it's a protocol that many of the smart home manufacturers, the security protocol that everyone's getting on, that will allow for tighter control and privacy and security. So thank you so much, Ravi.
I love it. All right, folks, this is absolutely amazing. Thanks so much to everybody for the questions. Thanks to you all for a brilliant demo. And John, I'm just blown away at your cameraman skills with your phone. That went that seems like you do it every day. Any final thoughts or anything that you all wanted to say that didn't say? And we'll make sure to get the recording up with the website and the contact, and hopefully some of our folks come out and visit y'all.
Yeah, just to thank you all and everybody on the webinar. It's a great pleasure to talk about the work we're doing to get ideas. I mean, we're looking for great ideas and great partners, and this is one of the ways that we get to talk about what we do and get the feedback. So yeah, thank you.
Excellent. I'm so charged up that you've got students in there working on their projects, and this is really exciting for all of our futures. So, all right, folks, have a great weekend. Again, thanks to the folks at University of Pittsburgh, and we'll see you all at